Waging a war against Ebola. Changes just announced by the Centers for Disease Control affecting travelers at New York City airports. Good evening, I'm Dana Tyler. An Ebola death in Texas prompts new precautions tonight right here in the tri-state area. In addition to hazardous items, airport security officers will begin screening passengers for symptoms of the deadly disease. CBS 2's Alice Gaynor live at Kennedy Airport with how it'll affect travelers. Alice?
Dana, JFK Airport here will begin taking the temperatures of travelers coming in from West Africa beginning on Saturday. Now, to do so, they'll use a non-contact thermometer. Nearby Newark Airport will also begin doing the same starting next week, and it is all to add another layer of protection. 42-year-old Liberian man Thomas Eric Duncan, the first person in the U.S. to die from Ebola after bringing it back from Liberia.
When one person, a single person, got through, Mr. Duncan, it threw a huge metropolitan area into total discombobulation.
Local and federal officials are stressing the importance of exit screening in Ebola-affected countries while announcing new entrance screening measures at 5 U.S. airports: JFK, Newark, Washington Dulles, Chicago O'Hare, and Atlanta International.
Screening on U.S. soil will almost certainly be better than screening just in Africa. It provides a second layer of protection, number one, in case the African screening didn't go well. Second, the actual screening, the questions that people are going to be asked here are going to be much more extensive. In many places in Africa, they'd simply ask, did you get in contact with someone who had Ebola? The person would say no.
The CDC is sending additional staff to each of the 5 airports. It will work like this. Customs and Border Patrol will review passports. If a person has traveled from Guinea, Liberia, and Sierra Leone, they'll be escorted to an area set aside for screening. They'll be observed for signs of illness and asked a series of health and exposure questions. Then their temperature will be taken with that non-contact thermometer. If they have a fever or something else reveals possible Ebola exposure, they'll be evaluated by a CDC quarantine station officer. Today, the CDC responded to questions about the possibility of an outright ban on travel to West Africa.
If we make it harder to respond to the outbreak in West Africa, it will spread not only in those 3 countries, but to other parts of Africa, and will ultimately increase the risk here.
Additionally, agents at all other U.S. entry ports are being told to observe travelers as well. For now, we are live outside of JFK Airport. Alice Gaynor, CBS 2 News.